Do you know what happens during a heart attack? It's a question that might make your own heart skip a beat, but it's an important one. Today, we'll delve into the world of the cardiovascular system, specifically focusing on two critical conditions: angina and myocardial infarction. Firstly, angina. It's more than just a fancy medical term, it's a real and pressing issue for many. Angina is a type of chest pain caused by reduced blood flow to the heart. It's like a warning sign, a neon flashing light, alerting you that your heart isn't getting enough oxygen-rich blood. Now picture this. When the body needs energy, it sends out a distress signal in the form of pain. Angina feels like pressure or squeezing in your chest. Some people describe it as feeling like a heavy weight has been placed on their chest. Others say it's more like indigestion. But what causes angina? It's typically the result of heart disease, a buildup of fatty deposits in your coronary arteries. These deposits narrow the arteries and restrict the flow of blood, much like a highway congested with traffic. When it comes to treatment, the goal is to reduce pain and prevent symptoms. This could involve lifestyle changes, medication, and in some cases, surgical procedures. Now let's turn our attention to myocardial infarction, a term that might sound intimidating, but it's simply the medical name for a heart attack. A myocardial infarction occurs when blood flow to a part of the heart is blocked, often by a blood clot. This can damage or destroy part of the heart muscle. Unlike angina, which is akin to a warning light, a myocardial infarction is an emergency, a full-blown red alert. Symptoms can range from chest pain and shortness of breath to nausea and cold sweats. But what causes a myocardial infarction? It's usually the result of coronary artery disease, where those fatty deposits we talked about earlier block the arteries. When it comes to treatment, time is of the essence. The sooner treatment begins, the better the chance of limiting the damage. Treatments can include medications to break up the clot, procedures to restore blood flow, and lifestyle changes to prevent future heart attacks. In summary, angina and myocardial infarction are both serious cardiovascular conditions linked to reduced blood flow to the heart. Angina acts as a warning sign, while myocardial infarction is a full-scale heart attack. Both conditions require medical attention and, in many cases, lifestyle changes to manage symptoms and prevent future occurrences. Understanding these conditions is the first step towards better heart health. Remember, an ounce of prevention is worth a pound of cure. Stay heart smart and take care of your ticker.